A very good evening to everyone. On behalf of ISA Mumbai Metro, it gives me, Dr. Gauri Ganga Hedkar, great pleasure to welcome all of you to today's session. Our session today, as all of you must have read, is Transforming Anesthesia Practice with AI, Decision Support, Workflows, and Intelligent Learning. We're genuinely thrilled by the response. Over 450 participants have already registered with us, and I'm sure a lot more will join in directly through the Zoom link. And so many more through the YouTube link will continue to benefit from this session. And this just reflects how important, relevant, and exciting this topic for us today is. Artificial intelligence is clearly something that's not on the horizon. It's here. It's reshaping how we think, we learn, how we behave on a daily basis. All of us are already using it in our daily lives. What we're here to learn today is how we can use it, how we can channelize this AI for perioperative risk assessment, intraoperative decision support, and even to use how when we teach or communicate with patients. It is clearly beginning to influence every step of the perioperative journey. Our program today is not theoretical. I'm sure you've seen a lot of theoretical flyers around, you've seen courses, but this one is designed to be practical. We're looking at real world solutions and we're looking at AI that's immediately applicable to your patients today or even tomorrow. It's not about what it can do for you someday. It's about how you can use it in your practice just tomorrow. We're very fortunate today to have with us excellent speakers who bring both clarity and hands-on session experience in this space. And I'm telling you this with experience. I've heard both of them speak and they are brilliant. This session is going to be interactive, so I encourage all of you to participate actively during the Q&A segment. I have a small request from my end. The first of which is because this is a session that's novel, we're going to be circulating feedback forms through the chat box. And eventually, I'll get back to each and every one of you who's logged in and get your feedback on the session. We're hoping to design further such sessions which will elevate your learning experience. It is now my privilege to introduce our moderators for the evening. We're honored to have with us Dr. Sona Dave, who is a professor in the TNMC and BYL Nair Hospital. She is the in charge of the plastic OT, a guide for MUHS Regional Anesthesia Fellowship, a past president of the ISA Mumbai Metro, past president ACTA Mumbai, and a member of the IEC. We also have with us Dr. Shweta Salgaonkar, who is a professor in anesthesiology and a pain consultant at the CHGS Medical College and KEM Hospital. She is the president ISA Mumbai Metro for 25-26. Madam is a vast facilitator. She is the program lead for Dialogue, which is a workshop for non-technical skills for health workers. She's done a one-year advanced course in medical education and technology. Her areas of interest include the difficult airway, pain management and awareness, patient safety and patient care, and even bird and nature exploration. Clearly, both the madams bring immense experience, insight, and they will bring a lot of clarity into academic discussions. Now, why I'm introducing the two of them is because this is such a big platform for us today. Had this been just an ISA Mumbai Metro event, both the madams would have needed no introduction at all. But given the popularity of the event, so many of us have joined in. I thought they should meet two of my teachers too. We're truly grateful to have them with us today. And I'm certain that under their moderation, this session will be both engaging and enriching for all of us. Thank you, madams, for being here today and guiding our discussion. Over to you, Shweta, madam.
Shweta, you're muted.
Thank you, Sona, and thank you, Gauri. That was very heartwarming welcome and introduction. So yeah, exactly what you said. We are so excited to have this webinar. Today's webinar, which is, we all are so much into AI, we are hearing so much about it, and it's time that we go a little bit into detail and see how we can practically apply it into our day-to-day patient care in the perioperative in ICU. So yes, well, just before introducing the first speaker, we have both the eminent speaker, who are very, very amazing in their this field of AI, apart from being doctors, anesthesiologists. So the first I want to announce that ISA Mumbai Metro is holding this infographic competition. As you can see the flyer, Gauri has shared it here. And here we are accepting this infographic, your entries from 10th May to 31st May, and I encourage all of you to participate in that. Gauri is extremely creative, and that's why she has put this up. This kind of competition is going to, make us do a lot of brainstorming, reflections, introspection, and we are going to come out with something really very nice. So I'm sure all of us have some or the other ideas which are very well depicted in just a page. So one page, one idea, that is how the topic is. And the details are there in the flyers, but do participate. We are encouraging you to do that, and we are hoping we are going to come out with something really amazing takeaways that we'll get it at the end of it. So coming to today's webinar, which is our transforming anesthesia practice with artificial intelligence, decision support, workflows, and intelligent learning. We have our first speaker, Dr. Meera Santosh. She is a clinician, innovator, and has used AI in healthcare, and she is a promoter. She's one of the first few ones who was so excited to use AI in anesthesia. And she's been very encouraging. She's been in touch with us. She's a consultant anesthesiologist at Gleneagles Hospital, Mumbai, very close to our KM. And of course, she's the ex-KMite. Let me tell you that as well. And she has her main focus on the perioperative care and clinical decision making, managing high-risk surgical patients, and experience in fast-paced, high-acuity environments. And she has had training in MIT Expro with AI in healthcare, and she is working at the intersection of clinical practice, AI, and digital health. Wow, what a combination. You are into fast pace, and I'm sure you're going to guide us also into the same. So since we have this AI curiosity, let's move from there to AI in daily practice. That's the message that Meera is giving us. So here, the first talk is going to be from preoperative to postoperative using AI for safer, smarter anesthesia care by Dr. Meera Santosh. Over to you, Meera. Welcome.
Thank you, Shweta ma'am, for such a wonderful introduction. It's my pleasure to be here, and thank you, ISC Mumbai Metro, for giving us this opportunity. Before we get into today's session, let me start with a small disclaimer that AI is not here to replace us. This session is not about learning something completely new. It's about how we are looking at what we already do, but a little differently. So I'm just going to share my screen. Give me a minute, please. Yeah. So, as anesthesiologists in our day-to-day practice, there's so much of a cognitive load that we come across. Patient history, we deal with so many high-risk patients. We have to look into the investigations, we have to look into the imaging. Information is often scattered across all the documentation that we have. And we bring all of this together mentally. We decide upon the ASA status of the patient. We decide what kind of an anesthesia management we have to go for the patient, all within a very short span of time. And this is how we've been trained, all our education, residency, our clinical practice. And it has definitely worked for us till now. But it also means that, especially in a busy OT, when you're doing a very high risk patient, the chances of missing something or making an error can be real. So, the question I would like to explore today is very simple. Can we bring more structure into this process and make our thinking a little more clear? So, my today's topic is going to be on that. This situation most of us have encountered in our daily practice. It's 3 a.m. in the morning, you're in the OT managing a high risk emergency laparotomy, and suddenly, through the whole surgery process, there's an unusual arrhythmia which pops up. You only have seconds to recall the differentials, drug doses, latest guideline. So at this time, wouldn't it help to have an assistant who summarizes and clarifies instantly? So what if AI could frame that decision for you in a very fast, structured, and a clear manner? This is how this is. So we have one tool is ChatGPT, and it brings chaos to clarity where every second counts. I'll go into detail of it. I'm just trying to adjust my screen. Just give me a minute. Yeah. So in real world practice, our anesthesia management approaches, it can vary for the same patient. We often don't work in idle conditions. We make decisions under pressure. We move between cases quickly. There's so many patients that we do over a period of one day. So there's so much of cases that happen. We rely on memory rather than a structured flow. Documentation at times may not be as detailed as our thinking, and communication depends on how clearly we articulate our thinking. Even for experienced clinicians, this is where small gaps can creep in, not because we don't know what to do, but the workflow itself is so complex and dynamic. So the challenge is not knowledge. We already know how to assess the risk for the patient. We already know how to plan anesthesia, manage complications. But the thinking is not often explicitly structured. It's not consistently documented, especially because we are working in such high pressure environment. And this at times can lead to variability, missed details, and inconsistent communication. So the question is, how do we bring structure without adding workload, without changing how we think? Um, our clinical judgment definitely is good enough, absolutely true. But this is not about replacing our judgment. What if we had a support layer that could help with the clinical judgment? So let's see where AI can actually help. When used correctly, it can help in decision support, helping structure the risk assessment and clinical reasoning. It can help with workflow support, wherein organizing information and reducing the cognitive load. And it can help in intelligent learning, making knowledge easier to access and apply in real time. So let's see how the AI tools support anesthesiologists in daily practice. Today, I'm going to be talking about Custom GPT, which is a part of ChatGPT and Claude. And both these AI tools help in preoperative assessment summaries, wherein it can quickly summarize complex patient histories, risk factors from uploaded notes or the EMR data. But one thing we have to be extremely careful about is that any document that we upload on these AI tools, you should not include any of the patient's details, like the name of the hospital. So all these private details should not be uploaded. Um, Next, it can help in anesthesia plan documentation. It can give it in a very structured manner. It can get the post-op notes as to how we want it, or even ICU handover summaries. At times, when you shift the patient to the the ICU is so busy, the intensivist might miss out on points which we have mentioned. But when we give this as an ICU handover summary, those points they still, I mean, those points stay there. So it's easy to have a proper ICU handover summary with these AI tools. It can help the residents for preparing for exams, learning scenarios, MCQs. It can also help with drug dosage. So almost every year we have so many new drugs coming in. It can help with infusion calculations, potential interactions, and it does it with explanations, not just numbers. It can help in summarizing the latest guidelines. Guidelines keep on changing every couple of years. So we could actually upload the PDF and summarize the guidelines, which will give us more clarity. Also protocols. There's difficult area protocols, malignant hypothermia protocols, anaphylaxis management steps. It can actually summarize the protocols in a very structured manner. So most of us have already interacted with tools like ChatGPT. What it does, I won't go into the detail, but it's a general purpose. The ChatGPT will not tell you how to structure a risk, how you think through anesthesia planning, how you'll prioritize in decision making. So the output that is generated is variable, generic, and not always aligned to the workflow. So the question becomes, what if we had a tool, a AI tool that could structure the risk the way we do our anesthesia practice, prioritize the decisions the way we do, and also think through the anesthesia planning the way we do? That's exactly what a custom GPT allows us to do. So let's see what exactly it is. It's not a new model. It's a structured assistant designed for a specific clinical role. So here you define how it thinks, what frameworks it is going to use, and what it should avoid. You can also add your own guidelines. So what the output you get is consistent, structured, and clinically aligned. And this is how we actually practice anesthesia. So let's see how to use the custom GPT. This is the homepage. I'll come to the live demo, but I'd like to explain. This is the homepage of ChatGPT. And here, when you click on more, it will take you to GPTs. There is a input called My GPTs and one is Create. So click on Create, and whenever you make your own custom GPT, it gets added to My GPT. And once you click on Create, this is a page which opens up where you can actually just create it or configure. Now, the difference between the two is Create is something like a normal ChatGPT wherein you ask questions and it's going to give an output. But when you configure, it's going to build your own custom GPT. And after you configure it, you'll be able to preview the GPT and actually interact with it. So I'll tell you how to add content to this. Here you could add the name. You could give a name to your GPT. Like for this, I'd like to say risk stratification perioperative anesthesia. Then you need to give a role to the custom GPT. So here you're going to say you're a clinical decision support assistant for anesthesiologists, and your role is to assist in perioperative assessment and planning across preoperative, intraoperative, and postoperative phases. Then, along with the description in the instructions mode, you also list a few things like what exactly you would need in a preoperative module, what exactly how the custom GPT would want to give you the output for intraoperative module, for the postoperative module, and what kind of a behavioral rule you would like to have the custom GPT to follow. And then we add some conversation starters like summarize this case in a structured pre-anesthesia format. What would the key clinical concerns be for this patient? And so on and so forth. Even give a quick risk stratification for this cause. How will I optimize this patient for before surgery, especially if we are doing a high risk surgery? And then, very interesting thing is knowledge. So here we can actually upload files like all our guidelines, the ASA statement on the ASA physical status, stop bank score, guidelines for acute ischemic score, preoperative assessment, any guidelines, any content that you need, all those files can actually be uploaded here. I think we can upload to more than around 50 to 60 files here. Even we can upload a complete book as well in a PDF format. And then most important is capabilities, wherein we keep this, we click on it and we ensure that it doesn't give any input from the internet. Otherwise, there's one feature of ChatGPT that it hallucinates, and we don't want it to hallucinate. So we will stop the inputs from all the capabilities. So this is how it looks once we have entered all the details. And then in the preview, the summary that we had entered, conversation starters, it comes in this manner. And then we can add our patient history to it, and with prompts, with inputs, it can actually give a output relevant to what we are asking and from the uploads that we've had. So a hypothetical case that I have made is 85-year-old male, hypertensive diabetic, AKI on CKD, not on dialysis, past history of CVA on antiplatelets, got admitted with fever, vomiting, tachypneic tachycardia, saturation of 98% on oxygen, shows bilateral pleural effusion, lowers on consolidation. Lab-wise, creatinine is on the higher side, 1.67. ABG shows 7.35 of pH. PCO2 is 29. Bicarbs is 16 and lactate is 3.4. Now, this patient's planned for laparoscopic cholecystectomy. Here, I have not included the ECG. ECG showed a right bundle branch block and 2D-KO was normal. So the question I would like to ask Custom GPT after uploading all these files that I just showed you is how would you approach the decision to proceed and what factors would you consider? So now let's see it in action. You'll have to bear with me, give me a minute, please. Yeah. So I've just opened this page. This is the ChatGPT page. Here on my left side is after. So if I show you this, this is the actual ChatGPT homepage. I'll go on Explore GPT, and this is the page which opens up. As I said, I can create I can create a new one, and once I create a new one, it gets uploaded on my GPT. So if I just click on create to show you, this is where we add all the information, select the files, recommended model, wherein we don't want any of these to be activated. And then we get a preview. So I'll just quickly show you the GPT which I have created. I'm just going to copy this patient details. So this is, I already made this because of time constraints. So I'm just going to edit this. And yeah, so this is it. So the name I've given is risk stratification perioperative anesthesia. Description I've already added. Instructions, as I said, is extremely important because you need to give a role to the custom GPT. So I've said you're a clinical decision support assistant designed for anesthesiologists focused on perioperative assessment and planning. And your purpose here is to support the clinicians in pre-op evaluation, intra-op problem solving, and post-op planning using clear, high clinical reasoning. Then approach is prioritize patient safety above all. Use structured stepwise reasoning. Do not assume any missing data. If you feel there's any data is missing, explicitly ask for it. Avoid hallucinations. Use validated frameworks, ASA classification, RCRI, stop bang, and reference standards as ASA physical status. So that's why I added all these files. And then, as I mentioned earlier, you tell the custom GPT to give you the output in a very structured manner, like pre-op module, case summary, ASA classification, key morbidities, all of this, fitness for surgery, justify the reasoning for that. Then for intraoperative module, again, similarly, what should the immediate assessment steps be? Stepwise management approach, when to escalate. Similar for post-op, respond whether now we are doing a high-risk patient, whether we should send the patient to the ward or ICU. So respond with reasoning, ventilation risk, monitoring priorities, pain management, also how to explain the risk to the patient and the relatives, all of that. Interaction style, you have to again mention, be concise, avoid textbook style and explanation because we are wanting a high output. So think like a senior anesthesiologist, explicitly flag high risk cases, similar thing. And then once you've done this, I've added these conversation starters, like I earlier mentioned. Summarize this case in a structured pre-op format. What are the key clinical concerns? Give a quick risk stratification. So any and more conversation starters which you think are relevant for that particular patient, you could just keep on adding to this list. Then, as I said, upload the file. So I already uploaded ASA guidelines, the stop bank score, the early management for CVA, all of this. You can upload many files with this. And I'm going to again click on this so that we don't use any of the internet details. So now it's going to give me the output only from these files which has been uploaded and all the relevant data that we've given. So now, and then it's given me a preview. So whatever the conversation starters were, summarize this case, it's already done this. So I just have to click on it and it's going to give me an answer. But obviously I need to first mention the surgery also, the anesthesia for the pre-op anesthesia for the patient. So I already uploaded the case here now, and I'm going to click on this button and I'll just, so let me write, how do I proceed for this patient? Patient. And again, if you make spelling mistakes, it's okay because it's going to ignore it. So let's see. I hope you're able to see my screen. So it says this is a high risk unstable patient proceeding directly to elective lab call is unsafe. So it's going to give its reasoning. It gives ASA classification, key morbidities impacting anesthesia. So it's giving a very structured format of the output. What are the major perioperative risks? So the whole idea is that obviously we know all of this, but when the output is in a structured manner, it helps in our thinking to make a better informed clinical decision for the patient. Again, the red flags is given, must not miss. Optimization checklist. So ChatGPT, the output is more of a checklist format. I'll come to this point again later. Immediate priorities, what we should know, optimize the patient, how will you optimize the patient, hemodynamic assessment. So it's given in a very structured manner. It says postpone the surgery, not fit. And then if we say that no, if the surgery cannot be postponed, so like keep on asking questions, and it will give the answers in that particular format. So it says bottom line, sepsis physiology patient, not a routine lab case. Delay surgery unless it is a source of control for a sepsis. And then it can and it's going to actually ask you questions, or you could ask your own questions and go about with it. So this is how the custom GPT functions. So this is again the same case. And one more thing about with ChatGPT now, with the new update, it can give the even infographic like a image generation. So if I enlarge my screen, it's actually showing the red flags, when to escalate, investigations, all of this in a very structured manner. So this is the output which has been given by the custom GPT, a proper clinical analysis. So in one screenshot or in one image, we can actually come to know as to how to, plan the surgery. Yeah. So moving forward, structure is one way to improve the clinical thinking. But what about complexity? What about the cases that don't fit a typical template? In anesthesia, we all know not every case is straightforward. We do so many high risk patients, conflicting priorities, uncertainty, and this in these moments, a template is not enough. We also need help thinking through the case in view of analysis, reasoning. So this is the next tool that I would like to introduce all of you to is Claude. It's an AI assistant by Anthropic. It's a next generation AI tool built for thoughtful, safe, and nuanced conversation. Now, how is it different from ChatGPT? So this is built by Anthropic, built by AI safety researchers, while ChatGPT is OpenAI. It's extremely careful. It thinks before it answers. It flags uncertainty, and it won't guess when it doesn't know. Unlike ChatGPT, it will give confident answers and can hallucinate. And actually hallucination is a very technical word which is actually used in the world of AI. That ChatGPT can hallucinate. But in Claude, because you're uploading the files, it's going to give you the information from those particular files only. Then Claude, it can read an entire patient file, research paper, long guidelines. Even ChatGPT does, but it may miss details in very long documents. And how does it respond? This is actually, I'll say the USP of Claude. It gives in a very methodical, step-by-step manner with reasoning. While ChatGPT gives a very structured, direct checklist kind of a format. Both are good, and they have their own reasons why we would like to use ChatGPT at times, or we would like to use Claude at the other times. And with Claude, it can actually explain why it can't answer and what you should do instead. Sometimes it's just ChatGPT will just say no without any explanation. So what's the best clinical use? When we are doing a complex case, so to give a good pre-op risk analysis, literature review, long discharge summaries, Claude is better because it will help in reasoning. Vis-a-vis ChatGPT helps with, ChatGPT will help with quick facts, simple queries, it generates images or slide visuals. So this is the home screen of Claude, very similar to what ChatGPT has. Again, the sidebar, if I just go back to this, if you see this plus sign here, if I click on it, this is what opens. You can start a new chat, search the past conversations, browse through projects, view the earlier chats, customize your experience with all of this. You can make your own projects with this, and also has a code feature, but I won't go into the details of that. Then you can even select your own model. So there are a few models in between which you can switch based upon what your output you want it to be. Like there's Opus 4.7. It's most powerful and used for complex, ambitious work. You can actually make an entire app out of it. Then you have Sonnet 4.6. It's for balance of speed and intelligence for everyday use. Then if you want a very fast response in a very quick and simple task, you have Haiku 4.5. And then there is a toggle adaptive thinking, in which the reasoning and analysis is the USP, and it can actually help with complex problems. So especially when we do our high risk patients, we could use this mode at that time. Again, like ChatGPT, we can add our files, photos, take a screenshot, add projects. You can have a lot of skills that we can use with this. Add connectors. Now, this is a very interesting input that Claude has. I'll talk in short about this a little later. So again, this is the same prompt which I use for ChatGPT. 85-year-old male. We already discussed this case. Now let us see how Claude responds to this case. So for Claude, I'm using the desktop version. There is a web version and desktop. So this is what I'm using. I've already entered the case over here. And the question, so this is the same 85-year-old patient that we've already discussed, plan for laparoscopic cholecystectomy. How would you approach the decision to proceed, and what factors would you consider? So you yourself can make out that the kind of output ChatGPT gave and vis-a-vis the output Claude is giving. It's giving in a very structured, analytical manner with reasoning. So it's going to first ask is, why is the surgery being planned? So it's actually going to ask questions if it feels that you should not go ahead with it. So I'll just quickly take this, go through it. It's going to analyze the ABG. It's going to even go deep dive into why, what exactly is the ABG profile, and it's going to diagnose it. It's going to take us through every system and give a risk assessment score for it. Like renal, as I said, creatinine was 1.6. So AKI likely, anyways, the patient had a history of AKI along with CKD. Cardiac risk. So it's going to actually give in a very tabular format for us to understand, have a detailed reasoning analysis, give a formal risk stratification score. It will give, it's actually asking 3 questions. Is the surgery the only choice? Can the patient be optimized? It's putting, inputs into our thinking as to how we should be going about it. Pre-op optimization is giving us inputs as to how we can optimize the patient. Anesthesia considerations. And at the end of it, it's going to give a summary decision. It's like a tree. Like, all of this. If surgery is unavoidable, do this. If it's avoidable, then treat the patient, optimize the patient. And then bottom line, do not proceed with lap call tonight. These are the reasons for it. So I've just added my own prompts. What clinical changes or parameters would make you reconsider? So again, it's given me a reasoning for this. What are the parameters? MAP, heart rate. So because it has a capability of reasoning, it's giving me a very structured output. Lactate clearance, because the lactates are high. Interpretation of that. It definitely helps in the anesthesia practice, where we can have such a detailed input output when we are doing a very high risk surgery. So I'm just quickly taking you through the whole thing. And again, after this, if you have any more questions, we could immediately we could put it in this box, and we can get an output. So this is how the Claude functions. So we gave the same prompt to both Custom GPT and Claude AI, and we saw the results. Let's compare the results. Response from Custom GPT, as you can see, is in a very checklist format, structured format, while that was a reasoning and analytical format. These are just the screenshots of the format that both the tools gave. I won't go into the details of this. So the response was 1-line summary, which it gave, while here it actually gave me an algorithm as to if you can wait for the surgery, do this. If the surgery is unavoidable, then optimize as much as possible, and bottom line. So the responses are different, but definitely both are structured. So same patient, same data, different thinking. When stakes are high, the depth of reasoning matters. With custom GPT, as I mentioned, it's a clinical reasoning engine. It builds a structured thought process, prioritizes decision-making flow, focuses on what matters most, and is flexible, adaptive, and real-time thinking. While Claude AI will it has this it will break the problem into parameters and thresholds, converts the thinking into checklist systems, define clear go no-go criteria, highly detailed. So Claude didn't just assess a patient, it thought like a consultant. It challenged the surgical plan. It mapped every physiological risk, offered a decision framework, and reminded us to have a goal of care conversation before we actually take the patient for surgery. So, in a nutshell, Claude is like a senior clinician thinking through a case out loud, while ChatGPT is going to give a structured clinical framework for a protocol being applied. And when to use, both are extremely good. Claude, when we have a bedside decision, teaching, webinars, rapid clinical thinking, scenario-based reasoning, is very good with analysis. While ChatGPT, because it gives a very structured checklist format, it can be used for SOPs, hospital protocols, validation framework, governance compliance, and decision support tools. So one gives structure, like ChatGPT gives structure, while the other will actually help you think through complexity. Now, what more can Claude do? Very, in very short, I'm going to tell you, it's an excellent tool. Apart from what I just showed you, there are other inputs which a Claude can do. It's a complete ecosystem. So it's just not a chatbot. It's actually a platform. It's got capabilities which we just saw: reasoning, summarizing, writing, analyzing, and answering complex clinical or research questions in depth. So it's always your available consultant for anything that you want. Then we have connectors, wherein you can connect the Claude to your existing tools like Google Drive, Notion. We can pull in our own document and data for context-aware responses. And actually, Claude will know your files. Then this Claude Code, it's a coding assistant for developers and researchers. I won't go into detail. Then we have CoWork. It's actually a desktop tool for non-developers like us, which can actually automate file and task management. Here, you don't need any coding skills. It can streamline repetitive administrative work. So it's like your digital office assistant. And there is this Claude in Chrome. It's a browsing agent that will work alongside you in real time. It will summarize the pages, extract key information, compare the guidelines right in your browser. So it's like Claude running shotgun while you browse. So again, if I can just go back to the demonstration, give me a minute. So go to the settings. These are the connectors. Now I've already connected my Notion, but we can just browse to the connectors. You have your Google Drive, Gmail, Canva, Calendar, all of this. You can just connect all of these to your Spotify, booking.com. You can just, anything that you want, you can just connect it to Claude and you can have your entire file ready. As I said, Google Drive, you can find your documents in seconds, find the latest version of Anaesthesia protocol. We have so many documents that we have. So you could just say latest version of Anaesthesia is going to it's going to give it to you. Google Calendar. There's so much of clutter in our Gmail. You can just clean your inbox even without reading every email. Summarize my 100 mails for this week. Canva ideas. We all use Canva for PPT. So you could just say that, make it into a poster presentation using the color combinations or a brand colors which we use, and it's going to give you the output. Other apps that can be connected are Granola, Notion, Gamma Prompt. So one prompt replaces hours of manual work. So your data stays in your connected accounts. Claude reads only the context, not just the keywords. So the key takeaways from today's session is anesthesia involves complex decisions made under time pressure. Information is often scattered across notes, labs, imaging, conversations. So here, AI is not going to replace a clinical judgment. It's just going to support it. It's just going to help us have a clarity as to how we move with the anesthesia management. is going to get structure and bringing clarity, consistency to our thinking. So two practical approaches with custom GPT, there's structured thinking, so there's consistency and standardization. While with Claude, there's adaptive thinking, this handling complexity and uncertainty. So the goal is not one information, we already have a cognitive load, but a clear decision making. So for me, as Shweta Madam said, I'm very interested in AI. So I did my fundamentals of AI in healthcare course from MIT last year. And it's extremely, AI is a field where there's so many things happening in the field of anesthesia. So happy to be a part of this. Thank you so much.
That was absolutely amazing demonstration, like a good hand holding, and I'm sure most of us are going to start using this right from tomorrow itself. That's so exciting because you made it so easy for us what all, how step by step we should be going and using it in the right way, taking care of the confidentiality and data, and still getting the input from AI and enhancing our own decision making and the patient care ultimately. So that was really nice. Very, very informative, really.
Thank
And
you.
yes, there are many questions that have come. If we take it at the end, that will be more interesting. So both of you can participate then. So we now go on to the next one. Meera, is that fine?
Yes, absolutely.
You are there, right? Till the end, no? Yeah, yeah. So we'll take up the questions. We are looking at the chat box. There are many, many questions. So we go to the next one, and I invite Dr. Sona to introduce our next speaker. Thank you, Meera. It was a wonderful lecture.
Thank you, ma'am.
Ma'am, I'll just share my screen so Avnish sir's CV slide can be displayed.
Thank you, Shweta, and thanks, Meera. Wonderful lecture. Really enjoyed. I've
Thank
heard
you,
you
ma'am.
before, and like it's just, always reinforcing me to further use all this. And I hope it is advantageous to all of you. Okay, now we wait for another brainstorming lecture by Dr. Avnish Khare. Now, he has a clinical background being an anesthesiologist and pain physician. He has now transitioned into full-time AI, and he's a consultant and researcher, BrainX AI USA advisor and mentor, IIHMR startups. Actually, he has a lot of them. Med AI subject matter expert educator. He's also visiting faculty for BITS Pilani Digital India advisor, AI wing of the Indian Society of Clinical Care of Medicine. I think so. Best it would be to hear Dr. Avnish himself and let his work speak for him. Over to Dr. Avnish.
Thank you, ma'am. First of all, a big thanks to the entire team of ISA Mumbai Metro for inviting me and giving this opportunity and stage to share my knowledge and experience with all of you. It was an excellent lecture by my colleague Dr. Meera, and she has made my work a lot easier. So I would like to tell you that I don't have any PPT. There's no PPT at all. It's going to be totally hands-on. I will just share my screen and you'll see my browser. I saw one question in the chat that how to make prompts. So I'll just address that in the initial 4-5 minutes. And then over the next 30-35 minutes, we'll go through a workflow which I have tried to design because in the meantime, okay, let me test how many of you know this. How many of you know the literal word of meaning doctor? So you can put it in the chat box. What does doctor actually mean in the language that it has been taken from? I think it is Latin or Greek language. But what does doctor mean? Meanwhile, I'll share my screen. Okay, so I hope you can see my screen now. And let me go to the chat and see what people have written. Okay, Dr. Gauri, only Dr. Gauri is awake as of now. So she has written, it means to change. So to change is very important. I completely agree with Dr. Gauri, but I would say that the meaning of doctor is this. or this. So it means a teacher, an educator, a person who shares knowledge, who shares experience, and that is how we ultimately benefit our patients. Okay, so it's very important to learn and then to also teach if you really consider yourself as a doctor. And this is one place where AI can help you a lot. And today's hands-on demo, which I'll give you, is going to be totally about this: how to use AI to learn faster and better, and how to teach faster and better. So I think it's very relevant topic to all of us on this call. Very difficult to cover in 35-40 minutes. Again, we can have a full day workshop around this, and we have been doing it, and we'll be planning some more activities with time if there is a lot of interest from people. Okay, so for the first part, how to create a prompt. Some people had questions when Dr. Meera was demonstrating. So see, whenever you get a task, just ask this question in your brain: can I use AI to help me in this task? So whether it's to create prompt, whether it's any other task in your day-to-day life, so that's called a AI first mindset. You have to build that mindset that if I want to create a prompt, can I use AI to create a prompt? And then you will get an answer, and you'll have to experiment, and you'll have to go and see whether it's possible or not. So I'll just go to ChatGPT, which is a tool which you have already seen. So Dr. Meera has covered ChatGPT and Claude, so you will relate better. So how you can use ChatGPT? She showed you custom GPT. So you can see on the left tab, there is a window called GPTs. And when you go down, there's something called Explore GPTs. So you go to Explore GPTs, and like you create a GPT, many other people have created GPTs already, and they have shared on this, like our Apple or our Google Android Play Store. And you can just go and search for whatever you want. So maybe I want to create a custom GPT prompt. So just write it in the search bar, and you'll see that there are so many GPTs, custom GPT and prompt builder, for example. So you can go and check, you can try 2 or 3 of these. So I just tried while Dr. Meera was presenting, and to save time, I'll just show you. But you can go to any one of these and try to chat with it and see if it can give you a prompt for your custom GPT. But I used this custom GPT called Custom GPT Prompt Generator, and I just went and told it I have an idea for a custom GPT, for a new custom GPT. This was the prompt, and then it gave me these questions. I had to answer all these questions. For example, what is the GPT's primary function? So I told I want to help it with giving me anesthesia clinical decision support. Then who is the intended user? I told it anesthesia doctor will be the intended user. What inputs? Patient information. I just gave very short informations for the sake of time, but you can be very detailed. And the more detailed you are, the better prompt you will get. And then it is asking me what outputs should be produced, any tone style required. All this, it needs information to create a good prompt for me. So I gave it that you should give it in a standard format which is clinically usable, and not too long, not too short. Use clinical guidelines like ASA, and it should act like a co-pilot. So it has given me this very nice prompt. See, so it has also given me the heading for my custom GPT, so I can use this as a title for my custom GPT, and this is the entire prompt which it has given me, and I can use this as an instruction, or I can further refine. I can go and tell that no, I want this, I don't want this. So it will keep refining this prompt, and in the end, which prompt I get here, I can just copy it and paste it in the instruction section, which Dr. Meera already showed you, and you will get your custom GPT ready within minutes. And just remember, even if you have built a custom GPT, it's not the final thing. You can always go back and edit it and revise it and improve it with your experience. And as you use this custom GPT, you will come to know that, okay, I just don't want ASA, maybe I want Mallampatti grading also, maybe I want some other thing also. So you can keep on adding those things, and also you can add more and more guidelines in the knowledge section of the custom GPT. So I hope I have taught you how to fish. As I told in the chat, like teach a person to fish and feed them for a life, or you give them a fish and you feed them for the particular time period. So I don't want to give you any prompts. Now I have taught you how to create prompts. Even if you don't use a custom GPT, you can go to simple chat GPT and you can tell it to create a prompt for you. And you can just, whatever is coming in your mind, whatever raw thing is coming in your mind, just type it here and tell ChatGPT to convert it into a structured prompt, and it will do it for you. So at least your 90% work is done. The remaining 10%, we human beings definitely should put our input, and it should always be human plus AI. So you can try with normal chat GPT also. So I think now many of you who are not confident, or who are feeling that creating a prompt is a bottleneck for me, how I will create it, it will take a lot of time. Now I have given you some idea or a tool which you can experiment and create any type of prompt using AI itself. Okay, this you can try in ChatGPT, you can do in Gemini, you can do in any other tool also, you can do in Grok also. You can see which one works best for you, which one gives you the best prompts, and then you can use that one regularly. Also, you can tell ChatGPT to ask you questions. Ask me questions before building the prompt. This you can add one line at the end of your conversation with ChatGPT when you are telling it to create a prompt. So it will keep asking you more and more questions. And sometimes we forget things, we forget to include in our prompt. So this is a method which acts like a checklist, and the AI will prompt you to give better responses, so it can give you a better prompt. So it's just a smart, intelligent way of using AI. Nothing fancy. Just comes with knowledge and experience. As you use these tools more and more, you will get more experienced. The best and most important thing is to practice. Okay, so now let's move to my part, which is about learning and teaching using AI. So I'll be showing you three tools. One is Google Gemini, one is Perplexity, and third is Notebook LM. So out of this, Gemini and Notebook LM are from Google, and Perplexity is a different company or startup. So these 4 or 5 tools which you see in this session, like ChatGPT, Claude, and these three tools which I show you, just install them in your mobile phone or on your laptop, bookmark them, and keep using these 4 or 5 tools more and more. Instead of using 10, 50 different tools, you just focus on these 4 or 5 tools and try to become better at these. Okay, so let's see, give me a topic, and now I want you to give me a topic in the chat what you want to explore. If you don't give me a topic, I'll choose from my end, but let us choose a topic maybe which we want to learn and we want to teach on. Any broad theme, topic, book chapter, heading, just give it to me in the chat. So I can see the chat. China is saying interested in workshop. Yes, definitely we'll come up with more hands-on kind of thing where you will be doing this with us instead of us just showing it to you. Yeah, laryngospasm, biostatistics, difficult mask ventilation. So and something which is evolving, or a recent topic, or where there are a lot of changes happening in guidelines on a day-to-day basis, or we need to keep learning. An idea on my mind is, for example, opioid-sparing anesthesia, if that rings some bells. So that is something which is quite in topic nowadays, and a lot of new things are coming in, or something related to pain management, because this regional anesthesia and all I can take, but you'll not enjoy that. Laryngospasm, again, it's very basic fixed protocols, not much change is happening. So should we go with opioid sparing anesthesia? Yeah, TIVA. TIVA is good. Okay, so let's go with TIVA. Sona ma'am says TIVA, TCI. This is a good topic. So suppose I am trying to learn about it, maybe as a resident doctor, maybe as a teacher, maybe on the bedside, or maybe there's a case posted in my OT and I want to just learn about it in a fast way so that I can understand it faster. So I just go to Google Gemini, and you can see that this is the interface. For those of you who have not seen Google Gemini, it's just like ChatGPT. There's a window to put your prompt, and there's a plus sign where you can add files, you can upload guidelines, you can add files from your Google Drive, you can do multiple things. And then in tools you can create an image, and then there's something called deep research which I'll be showing you. And there's also learn feature. So learn feature is also good, but it's not very good for advanced deep topics. The better one is deep research. Okay, so I'll just take a prompt from what I have already prepared to save time. So I go to Gemini, I choose deep research. So why deep research? Because this will go in a very deep research mode, and it will go to multiple websites, and it will search online in multiple places and then give me the result. So it takes a bit of time, but it's always worth it. So let me put a prompt, simple prompt. You can go and improve this in ChatGPT before putting it here. Now you know that. Latest evidence on. So let us see. here I will just replace the topic TIVA, TCI. Okay, focus on clinically actionable insights for anesthesiologists. Use sources only from credible journals. Okay, so you can be creative, you can set constraints, you can do all this. There's an entire workshop on prompt engineering. Now you can use different models. If you are using a paid version of Gemini, you can use the pro version also, but I will show you the free one, which is fast. For those of you who want a paid version, you can just buy a Geo SIM, and Geo is giving this free for 1.5 years, the pro version of Gemini. You don't have to spend any extra money. So once I click this, so it will start going and start generating a research plan, and you can expand it and see. So it is trying to construct a comprehensive research plan. It will outline the key areas it needs to investigate and strategies to connect. So it is giving me this plan that it will follow. So it will go for the latest clinical practice guidelines and expert consensus statements between this 2023 2026. So it will do all these 1 2 3 4 5 6 7 8 steps. Then it will analyze the results and create a report for me. So if I am okay with this, I'll just click on start research. Otherwise I can edit the plan, I can add a few steps, I can edit a few steps. Maybe I wanted to go to a specific medical journal, so I can write it here. But let's go to start research. So this thing I could have done even in a simple Gemini search, but it would not have given me this research plan, and it would not have gone so deep like it will go now. And you will see how many websites it will research in a small span of time. So it is just following those steps. Now it is going to these websites. See, these are so many websites, like it will go to hundreds of websites, which if you want to do it yourself, you will take at least 1 week to go to all these websites, read from them, bring out the details, and then try to read about the topic. But I want to help you do it faster, and you should feel empowered with AI. So this is how you use AI. So see, it is again going to multiple websites in another step. So each step it is going to different websites, trying to go to credible journals. As I told it, don't go to any non-medical website. So it is going to Frontiers and all these ResearchGate, PMC, all these websites it is going, and it is going to collect all the information and then present it to me as a report. So it takes a bit of time, it takes a few minutes. So let's give it time. I want to show you how it works. And you can see the progress here, and even you can go to some other window, and once it finishes it will give you a notification, so you can come back and have a look at it. And this, what you are seeing on the right side of the screen, this is called a canvas. So canvas means whatever is happening, it is showing you in real time. So you can see it is searching these websites, it is following the steps, and once the report is created, it will be created in the same window. So this is called canvas. Okay, so let it create it. So meanwhile, let me show you two other tools, just walk through of those tools. One is Perplexity. So this is also similar to Gemini. You will see a chat window, and you can again attach files. You can again choose where to search. There's a deep research mode here also, and you can choose which places you wanted to search. So you can choose only academic sources, or you can choose only social sources or websites. So all this customization you can do in Perplexity. Another advantage is this is like Google search. So if you want to fact check anything, if Gemini gives you something you want to fact check as a double layer or a second opinion, then Perplexity is a very good tool. So see, there are so many tools, and you can use one tool for everything, or you can use multiple tools for different things. I would go with second approach, because every tool is good at one particular thing, and Perplexity is very good at fact checking information and giving you the latest information. Anything which you would have used Google search for, try to use Perplexity. And third tool is Notebook LM, which we'll see as we move on. So this is something where you can upload your just a second. Sorry for my bad throat. So you can go here and you can upload many PDFs. For example, many of us have habit of downloading papers which we have read over the week, and then we want to again revise it or refine information from it. So you can use this tool. You can go and upload files, or you can also search here a fresh topic. So what we are doing right now in Gemini, this research work, this can happen in Notebook LM also as the first step. But since we are doing it here, I will not repeat it in Notebook LM, but you can write TIVA TCI here and it will go do a deep research. It will find out so many sources and it will add it on the left side. So if you don't have any PDF, don't worry. You can start from scratch also on Notebook LM and everything will be added to the sources. I'll show you how it gets added. So meanwhile, you can see our report is created. So if I was learning about TIVA and TCI, so it has given me a comprehensive analysis of pharmacokinetic modeling, patient outcomes and safety paradigms, and clinical advancement. So it has given me a detailed report, all with citations from where it has taken information. So there's very less chance of hallucination, not 0%, but still I can go and cross check. It has made some tables for easy learning and it has given me all these details. So I can now this report I can further ask questions or I can share and export it. I can download it as a Google Doc. I can share it with my colleagues, or I can also create some web page or infographic out of it. So I will show that to you. But before that, let me show you a few prompts how to deep dive. So now I got this report, such a long report, but I don't want to read it somehow. Maybe I'm in a hurry, and I just want it to give me 5 key takeaways. So I can do that. So it is summarizing it into 5 key takeaways for practicing anesthesiologist. So you can see it is working on the same report and it will convert it in real time into 5 key takeaways. So see, how you want to learn is now in your hand. Means it's not essential to learn from a textbook or to learn from a video. You can convert a video into some infographic and you can convert a report into an infographic. You can chat with the report, you can ask multiple questions. So all this is possible now because of AI, which definitely helps in better and faster learning because we are dealing with so much information on a daily basis. So these tools are definitely going to help us if we want to learn and teach. This is a huge boon for us. So I'm asking it questions, so it is giving me this, see. So it is converting it now into 5 key takeaways. See, so now it has given me this based on current medical evidence and updated clinical guidelines. So these are the 5 key takeaways. So it has given me 1, 2, 3, 4, 5. So pardon me, I am out of touch with anesthesia from last 4 or 5 years. So I cannot validate this, what it has given us. But I know there are enough of you on this call who are practicing anesthesiologists and many of you are quite experienced in TIVA TCI. So you can go through this and you can maybe validate it for accuracy, or if you are not satisfied, you can again go back to chat and you can ask it other questions. Some other prompts which you might put is like, what has changed in last 3 to 5 years? What is the evidence? Where is the evidence conflicting or uncertain? What are the ambiguity points? Then you can also ask to convert it into a practical framework or a checklist for you. So all these things can be done. It's just a matter of time, practice and imagination what you can do. So I just wanted to show you a demo. This is just to get you started, and this is not anything which is rocket science or quite complicated. You can do this right away after the webinar. Just let me show you one thing, which is creating infographic, because someone was asking about infographic also in the chat. So one way is to create through ChatGPT. Another way is to create using Gemini also. So you can do a deep research and then come here and create an infographic out of this report. So let it create an infographic. So it is creating an infographic. Okay, so see, it is doing all the coding. I don't expect any of you on this call to know coding. I also don't know, but this Copilot is working for me, this Gemini, and it's doing all the heavy lifting coding behind the scene, because anything you create on laptop or mobile needs to go through coding, which was a big bottleneck for people like us. Then Canva came. Canva made things very easy, but still a lot of coding is needed sometimes. So if you want to create this kind of infographic, this much amount of coding would have to be written, and you would have had to hire some engineering background person to build this for you. But see, now it has given you this nice infographic. You can take screenshots, or you can consume information in this way also if you like. So just a matter of few clicks, and this was just to show you the possibility of Gemini. And let us now move to the next tool, which is Perplexity, which I told you is very good for fact checking. So this is one use case I want to show you. Suppose this Gemini gave me this paragraph, this line, that TIVA is the gold standard for ICP control and provides superior brain relaxation. I don't know, maybe Gemini has hallucinated, although it is giving me a source, but I want to check this. So I will copy this from here, and I will go to Perplexity, and I will just tell it to fact check this content. Okay, I will just tell it to so I will just tell it to fact check this statement. Okay, and I will just paste it, and in the sources, connectors and sources, I will choose only academic sources. I will unselect web, because I want only academic answers. I don't want any website which has written this line. I don't want that. So now when I click it, it will go and it will start fact checking it. It will search the web. All this you could have done using Google search, but it would have been very manual task for you. But now you can see it has fact checked, and it is telling the statement is partially supported but overstated and lacks evidence for the specific gold standard claim and 81.4% figure. So now it is giving me the source also from where it has taken this, and finally it has told me there's no specific matching data for this, but I can go and I can check deeper into these, and I can further have a chat. I can go and I can further have a chat on this. So this is a way of doing deeper research after you have taken an initial thing from Gemini, and to also fact check things, especially the figures, like any numbers or any particular claim like gold standard. So all those things, always a good practice to double check. Definitely from medical textbooks, but it's easier said than done. You going to your book and then opening it, then searching the topic and then confirming it. Most of us use Google search, right? That also is not very accurate. Sometimes it gives a wrong information. Nowadays it is giving AI mode information, which is again hallucinated, but this Perplexity is very good. So this was one use case which I wanted to show you on Perplexity for fact check. If any fact checking comes, please think about Perplexity, and I can always go and have further chat with Perplexity. I can go and I can further write that, okay, recent RCTs and high quality evidence on TCI. So you don't have to run deep research for everything. You can have simple questions also, and you need very fast answers, simple answers. So this will give you a list of RCTs from 2022 to 24, and it is also giving you the source, so you can go and check. So very less chances of hallucination, and it will not cause embarrassment later when people tell that you have taken hallucinated information. So this is very important as a educator and a teacher. So I showed you Gemini, I showed you Perplexity. Perplexity you can use for other things also, creating image, getting a write-up, many other things which you use other tools for, but this is the best tool for anything that needs searching or fact checking. So that is one use case which I will stick to, and now we'll move to the last tool, which is Notebook LM, very important. So last 15 minutes I'll dedicate to Notebook LM. I hope you are getting what I'm telling you, and now you will be able to use these two tools, which is Gemini for deep research, for learning, converting into infographic and many other formats. You can check others on your own. It's free tool. And then Perplexity for fact checking, bedside fact checking, and all those things you can do using Perplexity. So let me look at the chat once. Okay, does it require paid version of ChatGPT? I'll take questions in the end. How to yeah, so Dr. Jiten, we'll take this towards the end. Let me finish with my demo part. So this is the last tool, which is Notebook LM, and by last, I would say that this is last but not the least, and in fact the most important tool now, because this is actually built for learning and teaching. If you don't believe me, I'll just show you its power. If you have PDFs, you can upload those PDFs. If you have any deep research report which you have created, you can copy this and you can paste it as a copied text, and it will be included here in the sources. Or you can also upload any YouTube video. For example, you saw a very nice YouTube video on TCI and you want to add it here. It's a 3-hour video, a webinar, but you want to just get the insights out of it fast. You can go to this and you can paste the link of the video here, and it gets included as a source. So multiple places you can, multiple types of things you can add. Just let me show you the power of this search, which is TCI. I just wrote TCI for anesthesia, only credible medical journals. And there's two types of research: fast search and deep search. Deep research is same which I showed you in Gemini. Fast research searches on the same topic but takes out less sources. Only the difference is number of sources and time it takes more for deep research. So for the sake of time, I will just choose fast research, and once you click, you will see that it has started researching websites. The same thing that it was doing in Gemini deep research, now it is doing in the same window. There are 3 panels here, so I will take you through each panel one by one. So this is the first panel on the left side, which is sources. So here is everything you add here, whatever sources, any PDF, any YouTube video, any paper, anything you want to add, you add here. And see, it has given me these sources. It thinks these papers are relevant for my topic, and I can choose any of these. I can deselect anyone. I can even go to the paper and check what the paper is, which it is telling me. If it is not relevant, I will deselect it. But right now, let me take all of them and I'll click import. And you can see, as soon as I click import, all these get populated on the sources tab, and all these are now becoming sources. What do you mean by sources? Now these sources will be used to answer any question which I ask. So everything which I ask this AI now is going to be grounded in these sources. Sometimes some sources don't load because of some paywall issues or some other things. So what you do is you simply go to this source and you remove all failed sources. So now it has 9 sources, you can see, and from these 9 sources it is giving me, in the central window, which is the chat window, it is giving me a small summary about what these sources are. I can choose to use it, ignore it, or I can ask my own questions here. It is also suggesting me some questions, but let me ask my own questions which I want to know. So maybe I can say I don't have time, and see, we all are busy. So organize this into key concepts for anesthesiologists, clear headings, bullet points, and I can say 200 words. And this is just like ChatGPT, Gemini, other AI tools, but the difference is now whatever answer it will show here, it will come from only these sources, 9 sources. And if I want to add any book also in multiple parts, of course I should be owning that book, and also you should be very careful about the copyright issues, whether you own the book or it's a pirated version. All those things I will not delve into, those are ethical issues, but you are all smart adults, responsible people, so you know what to do, what not to do. But anything you put here, that will be used to give you answer in this window. So now it is telling me that these are the key concepts. It has organized it into the key concepts and into bullet points, as I told it, with clear headings, and 200 words. If I would have told it 1000 words, it would have done in 1000 words. And now the very interesting thing is, you can copy this from here, or you can save to note. When you click save to note, it starts getting saved here, and from here I can push it into source. So I can push anything here what I create as a source here. So now this also becomes a source, and any question which I ask further, this will also be used to answer. And suppose I want to know where it took this line from, I just click on this and it will go and it will tell me it took from this article. This is the article, this is the link, and this is the paragraph from where it took it, and this is the summary of that article. So it's like a very good research tool, and for diving deep, and you are sure that it is not hallucinating because it is giving you answers only from the sources that you have selected. So I hope it is clear. Choosing the sources, searching for sources. If you already have sources, you can upload them. Then you can chat with them just like you would have done in ChatGPT or Claude. Even this, you can ask it to give you a clinical decision kind of a framework for a patient with TIVA, and it will do it for you using these sources. Of course, you should make sure you have some papers which have those frameworks, otherwise it won't give you the answer and it will tell you that I'm not able to find anything here. That all, it's very honest. I have tried this a few times. If I don't include any relevant source and ask it a question, it will say that this source is not there. So that is the thing. And finally, last 10 minutes, let us see this last window, which is very, very important, which is the studio. And this is the second part of my talk, that it is about teaching. So I have learned things. I have used Gemini to learn faster and get evidence faster, then fact check things using. Then I have learned how to use Notebook LM to get information on a topic from credible, relevant sources, and how to chat with it. And now I want to use this tool to create content for teaching. I'm a teacher. I want to create a PPT. I want to create a infographic. I want to create a flashcards. I want to create a quiz. So all these things now, Notebook LM has made it very easy by adding these as buttons on this window. So you don't have to give a prompt every time. So what you have to do is just you go and you click on any button. For example, you want to create a slide deck. You click on this arrow button, and then it will ask you what kind of slides. You can create presenter slides, and then you can choose the length, short or default. So in short, it gives around 5 to 8 slides, and in default, it gives around 10 to 15 slides. So I told it in short, and I can also give a custom prompt here to further refine. But for the sake of time, let me just show you something interesting. I don't know if Marathi is here. I'm sorry for being language centric, but I know many people of you on the call are from Mumbai, and you all will be knowing Marathi. Let us try to make it interesting. So let me see if it can generate a slide deck in Marathi, which maybe I can use as a patient education kind of a thing. So this is the idea. Then I want to show you something called a mind map. So and I also want to show you something called infographic. Okay, so infographic also I will choose. So all of you on the call will validate this for me if it is doing correct Marathi. So concise. So patient information leaflet to be given before the procedure. So let us generate an infographic. So it takes time to generate all these things, so I'm just selecting them together so that I can save some time. Meanwhile, mind map is created. So mind map is nothing but a flow chart. So all this information which is in the sources gets converted into kind of a flow chart, which is a mind map, and it organizes all the topics which are there. So the main topic is TIVA. Within it, it has sources which are related to all these topics like pharmacological agents, environmental impact, special populations, specific clinical context. And wherever I want to go deeper, I can click on this arrow and it will expand. So reduction in carbon emissions, global warming, potential comparison. So all these different topics. So you can choose one topic and then do a webinar on each one of these topics. So it's a very good tool for brainstorming topics to write something on. So this is very good for content creators also. If you are a medical content creator or you want to dive deeper into your topic, or you're writing a paper where you need headings and subheadings, so this is a great tool. You can download this also, and it gets downloaded as a JPG format. Okay, so this was mind map. Now let us go and see slide deck and infographic it is creating. So when you go back from this webinar, I want you to try this audio overview. It creates a small podcast of 5 minutes, 10 minutes, which you can listen while you are driving your car, or maybe you want to give to your students. So while they are getting ready in the morning before your class, they can just go through this fast 10 minutes podcast and they can come prepared for the class. So this is one very good use case. Then video overview, similar thing, just like a podcast is only audio, this video is video plus audio. So you can create that kind of a multimedia thing also. And reports is nothing but you can create a blog post, you can create a study guide, you can create a briefing document, or any other thing. Maybe you want to create a checklist, so you can create a checklist using this reports feature. Quiz and infographic, I want you to try yourself. Quiz and flashcards. So just when you click flashcards, it will create flashcards out of this topic, and then you can share those flashcards with your students, so they can also learn using flashcards. And quiz also is a similar way. You can share everything which is created here just with a share button. And data table, if you want to create some kind of a data table from your sources, this is again something that you can do. So okay, let me click on flashcards. Okay, so when it gets created, I'll just show this to you, and then maybe we'll go into I think Q&A, as I think we are on time. I have another 5 minutes. So any questions? Meanwhile, let me see the chat. So Shaina, we can create an app, and I had kept it in the workflow, but I think we'll need time for that, and maybe we can do this in the next session. You can create an app for this TIVA thing just by using Gemini. I'll give you a hint. You can go to Gemini, and you can go to a new chat, and here what you can do is in the new chat there's tools. In tools you can choose Canvas, and you can choose the pro version here because it's better at creating an app. But if you want to just create using a fast version, you can just write the prompt here: please create an app for helping my students learn about TCI, and I want these features. And it will give you a very nice app. It will do all the coding, and you can just share that app with a share link, and then you can teach in your class using that app instead of using a PPT. So that is totally possible. I wanted to show you, but I'll end by just showing the output of Notebook LM. I'm just waiting for it to complete because that will take another 10-15 minutes. Yeah, I'll show you how to save the slide deck, Tanaji, don't worry. So these flashcards are ready in the meantime. So this is how flashcards look. So this is the question, for example, what is the 100-year global warming potential of 1 kg of desflurane? So you might know the answer, you might not. You can just click on it and it will flip, and if you can ask it to explain also, and if you are right, you can score yourself that okay, you got it right, and it keeps on moving. So there are 60 flashcards in this document, and if you want to just share it, you can go back and you can click on these 3 buttons and just share from here. Okay, so this was flashcards. Now this is infographic. This is created in Marathi. This is a patient information leaflet to share before they are undergoing TIVA procedure. I don't know if it is correct or not. Maybe some of you can validate in the chat that whether it is good enough to give to a patient. If not, then please remember, you can always refine. You can always go back. You can create multiple types of infographics. You can give a custom prompt in the infographic. You can change languages. You can create it in English. You can do a lot of things. This is just to get your brains activated. Okay, so I can see that people are writing superb, quite correct. So this works in many of my workshops. I use this even for dermatology workshop, one I did in INHS Ashwini. Also I showed them for dermatology, and this always works. So this is, I think, cross speciality. It is quite good in translating language also. So anywhere you need translation, that is also one place where Google, Gemini and Notebook LM is very good. Okay, so just like Perplexity is good for fact checking, so this is one very good use case of Gemini. So I showed you infographic, I showed you flashcards, I showed you TIVA, and now we'll just see the slide deck. So till it generates the slide deck, let me just give you a bonus. I hope I'll not make you late. I'll just give you a bonus because I always like making a bit of. Okay, so what I have done is I have gone to the same Gemini account which my Notebook LM is, because this is important, and I'll tell you why. So I have gone here and I will now choose Canvas. and I will let it remain fast for the sake of time, and I will click on add files, and you can see notebook LM. I can add a notebook here. So I can add this notebook which I created. So this is some other notebook, or maybe I can see, okay, this is the heading. So I will just select this notebook, and this notebook has been added as a file or as a backend. And now I will go and I will give a prompt for creating an app. So I will go and I will copy the prompt. I will tell create a simple web app for quick educational reference on TCI for anesthesiologists, key principles here. So let me just click, let's see what it builds. In the meantime, let us see the slide deck is ready. So this is the slide deck, and you can see it has created the slide deck. I can expand it. So this is Adunik Tiva. This is Paryavaran Sanrakshan, and all this thing it has mentioned. Then I can, so these are the slides. See, I don't know, I think these are pretty good slides, and I think almost ready to present. Then you could have mentioned the target audience in the chat, in the custom prompt, and you would have got a better customized PPT. And if you want to revise anything, you have again the revise button. If you click on revise, you can revise this slide, and you can make some changes here before downloading the final version. To download the final version, you just go and click on these three buttons, and you click on download PDF document or PowerPoint. Please remember, if you download it as a PowerPoint, it will get downloaded as a image files, so you cannot edit it. So that is another bonus, but that will keep for the another workshop. I'll just save this as a PDF, and let me go to the app. So it is doing the coding. You can see it has done all the coding in the background while I was showing you the PPT, and now it will show me the app. How many of you use Canva? You know Canva? So you might have a question, what do I do with the PPT which I generated from Notebook LM if I want to edit it? So for that you need a Canva Pro version, a paid version. It's 5,000 rupees a year. You need to have that. So you go to Canva and you click on presentations, and you upload the PDF which I downloaded from Notebook LM, and then you can do it. So I will choose presentation, and then I will upload my PDF. So I answered a question where they were asking how to download. So download is just from the three buttons, but now I upload it to Canva. I go one step further. I upload this to Canva. It is uploading. Okay, so this is the app. Okay, so this makes error sometimes. See, so I have to do nothing. Fix the app. I can see no UI. So I have uploaded this entire PDF, and I have brought it here in Canva. So now suppose I want to just edit this. I want to make it not Tiva, I want to make it something else. So I click it, I choose edit. I go to Magic Studio, which is and I do grab text. Okay, when you do grab text, this is a paid feature, so you will only get in Pro version. So when you click grab text, it will ask you, you select all text. You select all text and you click grab. So now this, which was uneditable because it was an image, now it will become editable and you can make changes. So if you buy the Canva Pro version and you use Notebook to create PPTs, you can edit your PPTs also. So the problem which was there, that Notebook LM gives a PPT you can't edit, that problem is totally solved using this feature. So my internet is lagging because I have a power cut here. But just to show you, I'll just end it here because otherwise it will overshoot. But I've showed you like how to do it. There's always iteration, reiteration. Always there are problems when you're showing things live. I could have screen recorded this and showed you very perfectly. So this is the app. This was the final thing. So this is the app which we have created. And you can always go back and you can edit it. The practical checklist it is giving me, so I can use this as a checklist before my procedure. So I think with this I've already overshot a bit, so I'll just stop it here, and I tried to cover as much as I could, and I hope this will be helpful to all of you. I'll stop sharing and hand it back to the organizers.
Thank you,
Thank you
Dr.
so much,
Avnish.
Avnish.
Excellent. Meaning it is like, we are graduating from just using ChatGPT as a search engine to something much, much more, learning tool, research tool. And it was excellent demonstration. But I don't know, I have been facing a lot of practical issues with all this. Like Canva also, like without the paid version, you are stuck.
Yes, so that is why I was very honest and transparent. You will need a paid version to use the feature of making the slides editable. If you don't want to make it editable, you can do the revise function in the Notebook LM itself. So that will help to revise, but exact changes you cannot make with the revise button. It will again use AI to refine that slide, which might not be according to your liking.
Yeah, and also Notebook LM, one thing, I tried uploading one textbook also. And when I tried to make flashcards with it, only the first chapter flashcards came.
So madam, there's a key to it. You break your PDF book into multiple PDFs, small parts, and you only put that part which you want to use for PDF. Like you want the initial 2 chapters, so you choose only those. Because if you put too many sources or very big sources in Notebook LM, it ignores a lot of things and uses what it wants. So that is you have to direct
That
it.
first chapter, meaning only the history part I was getting in anesthesia. I never got the other part.
So you divide the first chapter. There are many online tools to break your PDF into multiple parts. They are free tools. You can break it into multiple chapters, then use only chapter 1 as a source and then tell what infographic you want to create. I think it will create a better one.
Thank you very much.
It was a power-packed presentation, Avnish. And in such a short time, so crisply you have explained, and I'm sure many of us will be able to use it. What I wanted to know was that when we want to use it for the patient data, for using it during the clinical work, at that time, the cloud storage and how do we kind of create structured data to use it in that for the future use, we can make sense out of the data that we are doing it now, collecting it now.
Dr. Meera, you would like to address this?
I didn't
from
see
the
You can
clinical-
carry on.
Meera, you're there?
Yes, I'm there. Dr. Avnish,
Yeah,
please
yeah.
take this question.
Yeah, so I think about organization of information, ma'am, I think right now Google Drive is the best place, because you can, as Dr. Meera showed you, there are multiple connectors now, especially in Claude and even ChatGPT. And when you're using Gemini on Notebook LM, then Drive is definitely the best place to have all information. You have to be careful regarding the personal information of patients. For example, their name, their phone number, their address. Those things you have to remove. There's no easy shortcut or no other way to that. There are some companies which are working on de-anonymization of data at scale, but those are paid tools which are usually bought by big hospitals or big research centers to de-anonymize the data set. If you're doing it on your personal level, I would say that before uploading it on the Google Drive or uploading anywhere on Google Cloud or even adding as a attached file on ChatGPT, just just go through the document and make sure to remove it. You can either crop it if you're taking it as an image, or if it is a text form, then you can remove those things and put placeholders. So that is a manual task. I know it's not easy, but definitely we should never compromise with patient privacy, because it's better to be safe than be sorry. First, we have to save ourselves medico-legally. That is very important.
Even
There
for
are many.
apps,
Yes, Sona.
for apps also, meaning, are we allowed to create such apps without permission? There are many guidelines and permissions for the same. So what is
Yes.
the
Yes, so I would like to clarify. Thank you, ma'am, for bringing that question. So these apps which we are building on Google, these are meant only for personal use, only for your particular pilot if you want to do. And I would tell you to please don't use it on your patients right away. Maybe you can use it as a kind of a educational tool, or some kind of a simple calculation method which you want to replace, or maybe some kind of a checklist. All those things you can convert it into apps. These are not FDA approved, or they will have to go very detailed clinical trials and CDSCO trials, CDSCO certification to be approved for use at a large scale. And also you will need a very professional pipeline to build them as professional apps. These apps which you are sharing on Google, these are using Google tokens or your account tokens, and they are going to finish very fast. So you anyways cannot commercialize it and give it to many people. So these are for very personal use. That is a disclaimer at the bottom.
Thanks a
Just
lot,
to add
Dr.
to what Dr. Avnish is saying, we need governance as well. Like the apps that we build, like what Dr. Avnish just showed right now, it's more of a educational tool. But if we have to actually make something for real world, wherein we are using the patient data and the clinical scenarios that we're doing, we have to get it validated in a hospital in a structured manner, take ethics permission, have governance, all of that, and only then go ahead and build an app. And another question, ma'am, which you asked about the how much of a PDF. So there are these sites called I Love PDF. It's a free site. It actually helps in breaking the PDF, and the amount of the 100 to 200 MB at one point you can add. So like how Dr. Avnish said, just break the chapter in 100 to 200 MB and upload it, and I'm sure you'll be able to get your infographic.
Thanks a lot, Dr. Meera. Always a pleasure hearing you.
Meena, I wanted to ask you one question. Have you come across, are you using regularly AI for in your clinical scenarios, perioperative care? Are you using it?
Not really, but I'll say for making documentation for structured notes, yes. But as a clinical decision support system, one or two cases. But I'll be honest, I've not used it. But it's a very good AI tool, and we can use it just for analysis.
Is
Yeah,
it a
that's what I
time
wanted to
consuming?
know. Share, if you can share your experience, whatever you have used it. So that's what I was excited
So
to
like
listen to.
yeah, so like the case which I shared right now is actually a real case that we did at our workplace, and the tool can give you in a very structured manner as to risk stratification, how to even communicate with the patient, the surgeons, the relatives, and what steps that you should be taking at every in a pre-op, intra-op, post-op management. So it does help you think and have a structured way. So at times for even drug dosages for that matter, you can use this tool. So yes, we can do that. I've done it for a couple of cases, but it's always a learning that's there for everyone.
And if there is a conflict between the clinical and the AI, what do you go ahead with? The clinical decision
The
making?
clinical judgment, the clinical judgment, absolutely. Because AI is there to just help us. It's a support tool. Always, it's a support tool. It's not going to replace. And so, whatever we have been trained, whatever, so it's at the end, it's our judgment that we'll be using to treat a patient.
Maybe the prompt or the context is not enough that we have given, so there could be a discrepancy between the two. Yeah.
Absolutely.
Gauri, you
At times, it can hallucinate as well.
yeah, hallucination is a hallucination or confabulation, whatever, is very much part of the AI. It makes up the things on its own, and it can, that is just to keep you happy because it has to give you something, is it? So,
And another thing is medical legally, ma'am, we are responsible. So, I mean, any AI tool
I
judgment
fully
is
agree.
done. So the
Yes,
clinical
yes,
judgment,
fully agree.
the whole onus is going to be on us. So it's our judgment
So,
which is going to be.
so can I add
Yes.
to this excellent point by ma'am, because this is a very important dilemma which fortunately I am not facing now, because I'm not practicing, but definitely for a practicing clinician it's very important. Tomorrow there's a webinar on this in the NB AI course. I think many of you must have enrolled for that, and my topic is exactly algorithmic fairness, and there this exact thing uh, is going to be discussed, that what happens when there's ambiguity between AI output and physician judgment, and how we should look at it, how to avoid hallucination traps, for example, what is a checklist which we should keep in our mind. And just like ma'am, many times we ignore what the monitor says. Like we, as anesthetists, sometimes the monitor is saying something and logically we should do something, but we decide to not. Similarly,
Yeah.
AI is just like another extra monitor or a tool which doesn't reduce our responsibility or our medical legal liability, and it's ultimately it's being to be us who is going to be responsible, at least for the next few years to come. It's definitely not going to go away. So you always have the power to override. You have the authority to override any AI decision that is coming to you.
So
There's
if
something called
tomorrow AI,
Yeah, tomorrow.
explainable AI. There's something called as explainable AI. So any of these are those layers of interpretation that is there. So any of these that we are using, like Claude, is it the explainable AI?
So
Yeah, Dr.
what
Meera, and after me, Dr. Meera will add something.
so what happens is that if you see a airline, a flight, there's always a black box. Okay. And the reason why AI has not got into healthcare so well, the way it has gone into other industries like logistics, finance, even stock market for that matter, is that the black box is of extreme relevance. So in healthcare, we need to know what is going into the black box. All right. So that is what an explainable AI is, wherein we need to know what the input is. Depending upon that, it's going to be the output. So this is all about responsible AI and explainable AI, because we need to know, we should be able to explain that process. So Dr. Avnish, over to you.
Yeah, so that's just building on Dr. Meera's thing. So, see, any black box AI, there are some ways to make it explainable. So, for example, Claude gives you an answer that this is what you should do, but then you can again go back to Claude and ask it, please give me the reason for why you are
Okay.
telling me this. Please explain the reasoning, please, or what might be the pitfalls. So, like probing AI, which is a black box, sometimes gives you some very interesting insights, and it will go back and tell you that because it is like this, that is why I gave you this answer. So the black box AI becomes explainable AI, although there are limitations. You cannot make it completely explainable because even engineers don't understand how these models actually work and come to the answer. There are theories and hypotheses, just like we have in anesthesia, how anesthetic agents, inhalational agents work. But there are ways to improve the explainability of these tools with using prompting hacks and tricks and tips. The other AI, which is the conventional AI, even that is there are some ways to do that, but it is always preferable to use explainable AI models in healthcare, even if it is less accurate. So this is a paradox. If you have a more accurate AI model, more probability is that it will be a black box. And the more you try to make it explainable, the accuracy will reduce. So you have to make a trade-off between both these things and settle for a thing that is good enough for your thing. You cannot get everything. That there are two sides of the coin.
So one more question I was interested is that we are using so much of AI now. In near future, I'm sure so many of us would be using. You think it's going to reduce our critical thinking capacity and the dependence going to increase slowly? We are here at the interface at present, but 10 years down the line, you think that the clinical what do you call accuracy or this the patient direct connect is going to go down. I mean, of course, when we started using, we are still the people who have been putting hand on pulse and doing it, and not looking at the monitor when there's a problem. This generation is now looking at the monitor and not at the patient. So I don't know, with AI, where are we going to go?
Dr. Meera, you are
Yeah,
practicing.
so very relevant point. Last year when I'd gone to MIT, there's actually a research happening in MIT wherein they're saying that the reasoning is going to go down. Even our memory is going to reduce because we are relying so much on for AI tool for instant answers, instant responses. So actually, like what we have been taught in our anesthesia practice, hand on pulse, so important. Even today, I follow it in my practice. It's very relevant to what we are doing. It itself shows so many things. Vis-a-vis a AI tool is just going to give us answers, but it's not helping us use our brain, our own intellectual capacity. So there will be, I'll say that slowing of intelligence with use of this AI tool. So we need to know how much to use and when to use.
Yeah,
So
responsibly we'll have to use it.
I'll add to Dr. Meera. I'll say that it's very risky and very difficult to predict even what will happen 1 week from now. Although that is like a small bottom note, but then having seen things, I agree with Dr. Meera that there are two kinds of approaches to AI. Either you can be a passenger of AI, or you can be a driver of AI, and there's a very subtle difference between the two. One is telling AI to do work for you, and the other is using AI to help you hustle more. So if you are a driver of AI, we all should be aiming to be drivers of AI instead of passengers. It's always very easy to tell AI to create an infographic for you, but if you are able to think in your brain, okay, what kind of infographic, or what details I need to put in, what I don't want, all these questions, I don't think you should give up reasoning these questions even when you are using AI, and that would be the correct way. Don't use AI to cut your work, or to cut your hustle. Just use it to hustle better. I would just add that mindset approach. It's just about mindset. Most people won't be able to do it. This also I know. When most people will be using it as passengers, but that happens with any technology. When mobile phones came, we were learning numbers and memorizing them, and the person who used to memorize the most mobile numbers used to be the most intelligent person. That was one of the signs of intelligence. So maybe those skills or signs of intelligence will change as AI becomes more important. Maybe something else will come in which will be more important, like creative thinking, critical analysis. All those skills will need to be built and will become more important than simply memorizing or checking the things that we do now. So that I would add, just a philosophical touch, but yeah, very difficult to answer this question.
If I have to buy a paid version, which one would you suggest? I mean, you can't buy all of them. So which one would you recommend? Or either of you,
So
Meera or
yes,
Dr.
yes, yes. So I'll answer, and then Dr. Meera can add to this because it's all individualistic experience. I started with ChatGPT. I paid ChatGPT 2,000 rupees a month for 1 year. Then I switched to Gemini. Now I am switching to Claude. So it's always an evolving process. But I would say if you want to just pay for one tool, first you see that you, even if you need to pay for one tool, maybe that only one tool is Canva, because many of these tools are coming free. Gemini is free with the Geo SIM. For example, I told you 1.5 year you get the entire Gemini thing, and if you have one Gemini only, which is paid version for free with Geo, I think that is more than enough. But right now, if you ask me one tool, then go for Claude, take a Geo SIM, and ChatGPT, go with the Go version. Go version comes for around 200 rupees or 300 rupees a month, which is the middle version. That is good enough, and that is only if you need some second tool. If you don't need a second tool, Claude and Gemini are good enough as of now. They are the most advanced and front end things. Perplexity is free, and 5 deep researches you get in Perplexity for free every day. So don't need to pay for Perplexity. Dr. Meera, your experience? What
So,
do you prefer?
for me, I completely agree with what Dr. Avnish is saying. I used ChatGPT, the free version. I do have the paid version, but I use it for just prompting. I take that prompt, I use ChatGPT for brainstorming, and I give the entire thing to Claude. Claude is such an amazing tool. As I said, it's an ecosystem. You can just make a complete document. You can connect it to Notion. Like, ma'am, again, answering to your question about the data storage, apart from Google Drive, you have Notion. So if you connect Notion to Claude, you can save all your documents to Notion and you can edit it in Notion. So you have entire storage. You don't even have to bother about it. So for me, as I said, I just use it for prompting ChatGPT and I do my entire work on Claude because it helps me with reasoning, analytical thinking, and anything and everything. It's a paid. I do have a paid version of Claude though.
This notion is what meaning exactly? I don't have much idea about notion.
So Notion is something like a Word document, but it's online. So it has a complete it's like your workspace um, app. So you create a document using Claude, and you can directly save it in Notion. So it gives you more storage space, and it gives you in a very structured manner. So you can have your entire document. Say you're making some, say again TCI. Okay, so right from introduction, how will you use it, anything and everything that you would just save it on Notion.
We'll have to try.
Yeah, so
Yes.
it is like a notes app in your phone. You put all your notes in that app. So it is a advanced notes app where you can also add documents. You can create multiple formats, and it is all online, so you can access it from anywhere. Just like Google Drive plus Notes. So that you can call it Notion.
Thank you.
Thank you. I think most of the questions you answered, Avnish, very promptly there itself. And I'm sure all of them have enjoyed and learned a lot. Not only enjoyed, learned a lot from this. We have definitely learned. And I request Gauri to put up the vote of thanks then.
Can I just give
Yeah.
one line
Yeah,
message?
sure.
Please don't stop here. Just don't feel that now it is done. You just go rewatch this webinar if you are not able to follow it, and start using these tools. The more you use, the better you will become. There's no other way. Like there's no amount of webinars you do, no amount of videos you see, unless you use it and do it and practically feel it, it will not help. So that is one line message. Please get like hands on, do it yourself.
And I'm sure so many have requested that they would be interested in workshop. So I'm sure this will be followed up sooner. We have probably 1 or 2 months of the experience hands-on ourselves, and then probably we'll be ready to take up as the way you are going fast, we'll have to practice a little bit and come.
Yeah, many things will change also, ma'am. So we'll be evolving as we go on.
Yes,
Yeah.
yeah. Definitely we do it. This will be followed up with the hands-on workshop. Yeah.
Sure.
Ma'am, even I need to make an announcement actually. Very happy to
Yes.
share that I'm a part of an organization, the Innovation Story. We have collaborated with Gleneagles Hospital for a summit that we're doing in October. The dates are, we're still fluid about the dates, either 9th, 10th, or maybe the third week of October, wherein it's going to be over a period of 2 days. On the first day, whatever right now we did, we are actually going to do hands-on AI tools. Dr. Avnish is also a part of it, wherein we'll be doing workshops for even how to actually use these tools, build a PowerPoint presentation, a workshop on agentic AI for clinicians. And the next day, there are going to be plenary sessions wherein we have also tied up with Actrek Tata Hospital. So it's going to be a very exciting summit. I'll share the details with all of you. But that's what's coming now in October.
Great going. Yes, we'll be part of it.
Yes, ma'am. I'll share the details.
Yes.
All the best, Meera.
Thank you, ma'am.
Gauri?
Yes, ma'am. As we come to the end of the session, it is my privilege to propose the vote of thanks. First and foremost, I would like to extend our sincere gratitude to both our speakers, Dr. Meera Santosh and Dr. Avnish Khare, for such practical and engaging talks. You've honestly helped all of us understand AI a lot more. And I'm sure that everyone who attended will use AI a lot more in their clinical practice. I would love to thank our moderators, Dr. Shweta Sargaonkar and Dr. Sona Dave, for steering the session so thoughtfully and asking the questions that all of us were thinking and not ready to ask. A special thanks to SAMS for lending us their platform for this meeting, to ISA Mumbai Metro, and to all of those involved behind the scenes in making this webinar a success. A big thank you to all of our participants for being here and for engaging so actively with all of our speakers, asking so many questions, making so sure that our session was totally worth it. We really hope that the session was useful to you. I take this opportunity to again invite you to participate in the infographic competition that the ISA Mumbai Metro is holding. It is for all ISA members, either ALMs or life members. We want you to take any topic for anesthesia, just one topic, one page. Whatever you like, there's no problem. There's just one hitch. I know that Dr. Avnish showed all of you how to use AI to make infographics. We decided to make life a little more complicated. We will not allow you to use AI. You can use AI to figure out what you want to put in your infographic. But yes, you need to make these infographics yourself. We start collecting our entries on the 10th of May. We are accepting entries till the 31st of May. And for a special prize, I was able to negotiate with our very kind president and secretary, and they let us choose the prize, which was an opportunity to participate as faculty in our upcoming webinar. Please, please, please do use this opportunity to be a part of this competition for ISA Mumbai Metro. I have added the entry dates and all the details. I will also be circulating it on social media soon. Thank you so much for joining us.
And Gauri, can we have a photo? All of us put the video on and we can you do that?
Yes, we
Yeah.
will do that.
Yeah, Meera and Avnish, can you be there with the video on?
Yeah, yes.
Yes, ma'am.
So we take one photo.
We
Even the
request all the participants
participants?
also to,
Yeah.
if they could turn on their videos, that would be lovely. We'll just take a quick photograph and send you off on your way to dinner. Thank you so much for all of you for taking time out on a weekday to join us after work.
It was wonderful. You're all
Thank you,
charged
ma'am.
up.
Excellent. Yes. Thank you very much.
Thank you,
Thank you,
Meera.
ma'am.
Thank
Thank
you,
you.
Avnish.
Thank you,
Thank
ISA
you.
Mumbai, for
Thank you.
giving me
Thank,
this opportunity.
thank you, ma'am. Thank you. Thank you,
We
Dr.
have the
Meera.
photographs.
Thanks
Thank
to
you so
the
much.
SAMS office bearers. And I think you said that your network was at stake, but you managed still to do this. That was good.
I'm still now the power is on. So there was
Okay.
a power cut because it's raining.
Yeah.
Thank God.
Thank you, ma'am.
Yeah. Yes, Meera.
Okay.
Okay. Thank
Good
you.
night.
Yeah. Bye-bye.